Can eyebrows be surgically reconstructed? This is a question many people ask, especially those who have lost their eyebrows due to various reasons such as illness, injury, or even overplucking. Surgical restoration of eyebrows is indeed possible, and usually involves transplanting hair from another part of the body, typically from the scalp. The hair is most often taken from the back of the head, where the hair is usually thicker and more resilient. The procedure is performed using the FUE technique, which stands for follicular unit extraction. This method is minimally invasive and allows for a natural-looking brow. Eyebrow transplantation is highly effective for people who have lost their hair due to illness, injury, or simply want to improve their aesthetic appearance. The results can be quite transformative. The final results of the transplant are visible after 6 to 12 months, as the transplanted hair needs time to grow and integrate with the existing eyebrow hair. Once the hair has grown in, it requires regular maintenance, just like natural eyebrows. This includes trimming and grooming to keep them looking their best. The procedure should be performed by an experienced specialist to ensure the best results, as an unattractive eyebrow line can be an even worse result than having no eyebrows at all. Therefore, choosing the right surgeon is crucial for a successful outcome.